Hi everyone. In this video we are going to learn about the first aid management for fracture. I am Jenlyn Bernard, working as tutor in MMM College of Nursing. This video will be helpful to you to understand and gain knowledge about fracture, causes for fracture, signs and symptoms of fracture, different types of fracture, and also the first aid management for fracture. Now let us see what is first aid. First aid refers to the emergency or immediate care should provide when a person is injured or ill until full medical treatment is available. In case of minor conditions, first aid care may be enough, but in serious conditions, first aid care should be continued until advanced medical care becomes available. What is fracture? A bone fracture is a break in the continuity of your bone. A significant percentage of bone fractures occur because of high force impact or stress. The causes for fracture is it can happen due to the direct or indirect force during any road traffic accidents, assault, fall, medical condition like osteoporosis, and also in few types of bone cancers. The signs and symptoms of fracture is there will be a severe pain, swelling, bruising, discolored skin around the affected area, protrusion of the affected area at an unusual angle, inability to put weight on the injured area, inability or difficulty to move the affected body part, a grating sensation in the affected bone or joint, bleeding if it is an open fracture. The fracture is mainly classified into two different types according to the involvement of soft tissue and especially the skin. That is closed fracture and open or compound fracture. Closed fracture. Damaged bone does not tear through the skin. So when we look from outside, the skin will be intact, but there will be a swelling and pain underlying tissues. Open fracture. Skin is torn and penetrated by the damaged bone. Here obviously we can see the broken skin and also the bleeding along with the fractured bone. According to the pattern how the fracture has happened on the bone, it is again classified into different types like transverse fracture, linear fracture, oblique fracture, spiral, green stick, comminuted, and also few types of fracture. Ulceration fracture. A muscle or ligament pulls on the bone and cause fracture. Comminuted fracture. An impact shatters the bone into many pieces. Compression or crush fracture. This generally occurs in the spongy bone in the spine. For example, the front portion of a vertebra in the spine may collapse due to osteoporosis. Fracture dislocation. This occurs when a joint dislocates and one of the bone of the joint fractures. Green stick fracture. The bone partially fractures on one side but does not break completely because the rest of the bone can bend. Hairline fracture. This is a thin partial fracture of the bone. Impact fracture. When a bone fractures, a piece of the bone may impact another bone. Intra-articular fracture. This occurs when a fracture extends into the surface of a joint. Longitudinal fracture. When the fracture extends along the length of the bone, it is called as longitudinal fracture. Oblique fracture. An oblique fracture is one that occurs opposite to a bone's long axis. Pathological fracture. This occurs when an underlying condition weakens the bone and causes a fracture. It's very common in osteoporosis. Spiral fracture. Here, at least one part of the bone twists during a break. Transverse fracture. This is a straight break across the bone. Stress fracture. Repeated stress and strain can cause fracture in a bone. It is very common among athletes. Now we can see the aims of first aid management in fracture. The first aid management prevent further damage. It prevent or minimize fracture related complications, reduce pain and discomfort to the victim, guide to seek early and appropriate medical care. The first aid management for the fracture supposed to be decided or selected based on the location and type of the fracture. In general, whenever there is a fracture, check the general condition of the patient, that is like consciousness and breathing. Examine the injury site for any obvious bleeding and related complications. Immobilize or support the affected body part with the adequately padded splint and dressing. Rinse and apply firm dressing if it is needed, especially in case of open fracture. Use cold application to manage or minimize the pain for the victim, and shift the patient as earliest to the hospital. If the patient is identified with a skull fracture, that is head injury, first identify and confirm or check the risk for head injury and assess the conscious level and general condition of the patient, especially the breathing pattern. Check for any soft or depression over the scalp. Check for vomiting, giddiness or loss of consciousness, and also observe for any kind of watery blood or clear fluid discharge from the nose or ear, and ensure to maintain the patent airway and transfer the patient immediately to the hospital. During the assessment, if the patient is identified with the fracture over the long bone, check and identify the site and do not massage the area because there may be a swelling, and apply firm dressing with adequately padded splint. Ensure the proper alignment of the body part. In case of upper arm, the arm sling can be used. Cold application can be helpful to reduce the pain for the victim and shift the patient to the hospital. During the assessment, if it is identified or if you find the patient is at risk for vertebral fracture, reassure the patient and don't allow the patient to move or change the position because it is at risk that the fracture can make injury to the spinal cord, and that may be leading to the permanent damages to the patient. And assess and monitor signs and symptoms of spinal involvement. Transfer the patient by using the log roll technique to avoid the spinal cord injury, and seek the medical care as early as possible. In this video, today we have seen about the first aid, fracture, and different types and signs and symptoms of fracture, and also we have seen the first aid management for fracture. For this I have referred from the internet, and thank you for listening.